Hello, my friends, and welcome to the Pathway channel. Today, I will discuss the actinic keratosis, and another name is the solar keratosis. From the name, these lesions are related to sun exposure, and they happen on sun-damaged skin. So we can expect them to happen in exposed sites like the face, arms, dorsum of the hand, and it can happen also on the lips, and this what we call the actinic cheilitis. From the name, and because it happened from sun exposure, so it has higher incidence in lightly pigmented individuals. And by the way, they have excellent prognosis, but they are precursor lesions for squamous cell carcinoma. For completion, the clinical picture for these lesions, they are yellow to brown scaly patches, and they have this sand paper sensation on touching. As we mentioned, they happen in sun-exposed sites, and they range from 1 centimeter or less than 1 centimeter in diameter. And sometimes they produce very big amounts of keratin, as we can see here. This is all keratin, and we call this the cutaneous horn. So you can see here how long or how big is this horn, and it's all formed by this keratin. I will start with the microscopic features, and I will start from superficial to deep. So from superficial first, as we can see just before we start, as just for orientation, we have here the epidermis, and we have here the dermis, and this is all the cutaneous horn we will speak about. So from superficial, we will start by saying that this lesion, it has this hyperkeratosis, and the superficial layer or the stratum corneum, they are thickened, and they have or they retain their nuclei. This is what we call the parakeratosis. So this is one feature that we will see in the superficial layer, and I hope you can appreciate from this low power, these blue dots, these are the retained nucleoli. So this is parakeratosis, and also we have some areas here where we have orthokeratosis. So these cells, they will lose their nuclei, and this happen on the areas that are just superficial to the hair follicles. So the parakeratosis does not involve the hair follicles. The other feature I will speak about, and it's better to see it on higher magnification, is the atypia that happens at the basal layer. So I will keep this when we go to a higher magnification. Third feature I want to mention here, maybe it's not that evident in this slide, is the solar elastosis, because we mentioned that these lesions, they happen or they are affected by the sun exposure, and they happen at damaged skin. So we expect to see this blue or gray color of the dermis, which will be an evidence that these are damaged areas of skin, but we don't have a sufficient specimen here. The fourth lesion or the fourth feature I will speak about, that we might have some sort of inflammation or lymphohistiocytic infiltrates, as we can see in this slide. So now I will go on a higher magnification to appreciate these features from superficial again to deep. So this is a higher magnification. This is the 20x. And I just want to show you here and want you to appreciate that these layer, the stratum corneum, they retain their nuclei. As you can see here, we have these bluish dots. They are all nuclei. And this is what we call the parakeratosis. I will go deeper. Yeah, here we started to have to see the epidermis here. And I will go on a lower magnification. Maybe this will give us opportunity to describe better the basal layer. Appreciate this basal atypia that happens here, and it's not with the full extension, or it does not include the full thickness of the epidermis. It's just at the basal layer, and this is difference between the actinic keratosis and the squamous cell carcinoma that may happen in situ. And this atypical cells, they will show some nuclear enlargement, as we can see on these cells. They will show some hyperchromasia, and sometimes we can see a prominent nucleoli. So we'll go on a higher power to appreciate it. This is on, we are at the 20x, and this is the basal layer. As you can see again here, we have enlarged cells. We have this prominent nucleoli that we can see. So this is what we call the basal atypia that happens in the actinic keratosis, and it does not include the full thickness of the epidermis. This is the dermis. It shows some edema, and again some inflammation, which can happen in actinic keratosis. If we go higher on this horn, you will see that again here, these cells, they have or they retain their nuclei. So this is the slide of the actinic keratosis. In summary, the features, microscopic features from superficial to deep, we have this hyperkeratosis or parakeratosis, and we have this atypia at the basal layer. Maybe it's more evident here, this atypical cells. And sometimes we have some inflammatory infiltrates in the dermis. And if we have larger specimen, we can see some solar elastosis. Thank you so much for watching this video. Please like and subscribe to the channel.